Here at the Clinical Research Network, we want to give all patients the opportunity to participate in clinical research in the primary care setting. Taking part in research studies allows patients access to all sorts of treatments and interventions that they wouldn't normally have access to on the NHS.
It's an opportunity for GP practices to become research active and to build up a portfolio of clinical research studies. Once they've gained experience, then we can then introduce larger and more complex studies to the practice.
And as a GP, I don't think you necessarily need formal research skills. What you need is the enthusiasm and the organisational skills to really engage your patients and get them involved in practice.
It allows me really to spend a lot of time with patients and sit down and really get to know them. But I think it also empowers them quite a lot as well.
Patients who take part in research studies do well, they learn more about their conditions and their outcomes are better.
It's been really convenient for me to take part in these studies because they're at my own GP's, which is near to me.
The Clinical Research Network provides the infrastructure to support the delivery of clinical research within primary care. This includes a team of nurses who can help support the delivery when required.
Some practices do have their own, say, practice nurses or research nurses delivering the study from start to finish. On the other hand, they can also be supported by primary care nurses from the CRN like myself and my team.
We are very, very well supported by the NIHR, both in administration and with clinicians. So we never feel like we're working on our own.
And the team who look after you and look after the study are really fantastic. And I feel quite happy that I'm having a thorough health check every time I go.
One of the main aspects of my role is engaging with GPs and GP practice managers and healthcare staff to promote research and ensure the safe setup and delivery of clinical research in primary care, and also help with patient recruitment.
The support that we offer can be from GCP training, good clinical practice training. We offer that to the GPs and the surgery staff, to site initiation visits, to the day-to-day running of the research that they choose to participate in.
It's a chance for us to give something back to the NHS. It's an opportunity to involve our patients. We've actually been very surprised how many patients have been enthusiastic about the research.
Traditionally, people may have thought primary care is just the GP practice. However, more recently, we have started to engage with pharmacies and care homes.
One of the reasons as a pharmacy we got involved in research is that we see a lot of walk-in patients with long-term conditions. We see these patients on a regular basis, so we have the scope then to recruit these patients.
It's financially beneficial to the practice. Finances are strained at the moment, so it's an additional income stream.
It shows patients that, you know, we're doing more than just our everyday services and dispensing prescriptions. We're actually trying to recruit patients into something that might benefit them long term, and it also shows when we have inspections as well, and, you know, gives us credibility that we are a pharmacy that's going above and beyond.
It's beneficial for the staff, the clinicians. It adds variety to the day job, and it also enhances their own personal development.
Research allows me to keep up to date with some of the new technologies in medicine, and also pass those on to patients for them to benefit.
One of the studies that we got involved with, one of the research studies, was the Salford Lung study, which was a really successful study. We worked really well with our walk-in patients because we dispensed the research medication for them, and we worked really well and collaborated with our local GPs as well.
I'm a GP who serves quite a diverse, ethnically diverse population, and I think it's really important to engage Black, Asian and minority ethnic patients in research who are traditionally underrepresented in health and social care research. And this will hopefully ensure that the treatment and interventions we offer them are fit for purpose. And I think primary care is a great, it is actually probably the best arena to do this.
As a GP, I've been involved in research for many years, and I'd really encourage everyone to take a look at it and consider how best you can take part in whatever capacity you're able.
There is ample parking. The GP surgery is often very close to home, so there's not that travelling involved. The familiarity of the surgery.
It's interesting, it's inspiring, it keeps your knowledge up to date, it brings income into the practice, but most of all it brings those opportunities to your patients.
I've really enjoyed taking part in this study. It's been so convenient because it's just been at my doctor's. I really hope that other people in Manchester will get the chance of carrying out research projects for themselves at their GPs.